Dr. Roger Klein, thank you for being with us, sir.
Thank you for having me, John.
All right, Dr. Klein, you have been an advocate of we have to get this economy opened again. Otherwise, it's going to be calamity for millions and millions and millions of people far into the future. Might take 2 decades to get out of it. Give us your take on what's happening, sir, right now.
Look, we're having a serious situation in the United States. People are getting sick and people are dying from a virus that is clearly, for some people, is very bad. But if you look at the numbers, they're not meeting the dire projections we were told.
Mm-hmm.
So it still is centered largely around the New York City metro area, and 40% of over 40 to 50% of the infections and deaths are in that area, and we're not seeing that experience replicated elsewhere. Although we have some cities, Detroit and New Orleans, that have had significant problems. Populous California is not experiencing the same thing. So really, the models that were being used haven't produced accurate results in terms of what's happening. They were fine for planning, but we're using for decision making models that thus far don't appear to be accurately projecting what's happening.
So if the models aren't accurate, then is our response not accurate?
Well, see, that's the question. So look, the numbers that we have are still, we're seeing more of a linear than an exponential rise. You hear those terms with curves. It's more like a line. Again, New York metro area is 6% of the population, but they're still accounting for 40+% of the cases of death. Now, that could change, but we're just not seeing it. And I think one of the reasons for that is the population density in New York, which I have to say, I spoke about this on media shows in February that I thought New York was a particular danger. So, we have models, economic models also, and they're predicting unemployment from the Great Depression, to the levels of the Great Depression, 18, 20%. Truthfully, I don't see any reason to place greater reliance on epidemiologic models than economic ones. And if you balance the considerations, I think we need a more nuanced approach.
What is the metric that we can utilize to start opening the economy back up? Because Dr. Klein, I've been saying since this started that I'm very concerned that we're only tracking one side of the model, which is the virus, the deaths, as I said before you came on, how many people have it, how many hospital beds we have. And I think, you certainly have to do that. That's the tracker. But we're not tracking the other side of it, the economic costs, the financial calamity, the businesses shutting down, the dreams being shattered, the families splitting up, the domestic violence, suicides, alcohol addiction, drug addiction, everything that goes with this, lost wages that go on for decades. How do we get that part measured, sir?
Yeah, I think you're right. And we measure it the same way we measure other economic factors, but we need to juxtapose those numbers. I thought the introduction when I came on that you put forth, I thought was brilliant. It's not that it isn't that this isn't bad or serious. It's that destroying the economic lives of millions of middle and working class Americans is serious too. And we need to balance considerations. That's why it's not solely a medical issue at this point. What I wish we had and that we don't have, but we could have, are better epidemiologic data through serology, which would show infections versus cases. Because right now our testing is very heavily biased toward sick people. So the disease itself looks much worse than it probably is for most people, although we don't know for sure the extent of that because we don't have antibody testing. It's called antibody testing or serology testing. And we could do that on a larger scale. It seems feasible. Mayo Clinic set up a relatively high throughput test, and I don't know if they're live yet. They announced they were going live with it, and I think we could do this. And we could do what's called surveillance, like you would do in the military. You see what's happening on the ground and where are we having a lot of infections. What's the the true death rate, the true hospitalization rate, and how severe really is it for most people. I think it would be helpful to understand that in targeting our response.
Dr. Klein is with us, MD, JD. He's a pathologist with a subspecialty certification in molecular generic pathology. He's an expert with the Regulatory Transparency Project's FDA and Health Working Group, senior policy advisor to the Heartland Institute. He has a law degree from Yale among his doctor's degrees, so very highly educated, very respected. So, Dr. Klein, I want to get to the drug that was used to treat malaria, right?
Chloroquine, hydroxychloroquine.
Chloroquine. I have to get this down, chloroquine. Some doctors have tested this with their patients, and it's, to me, should be a decision made between patient, doctor, hospital. The FDA and others are saying, the naysayers are saying it's anecdotal, Dr. Klein, but all the anecdotal evidence is pointing in one direction, and that's a pretty positive direction. You've got one doctor in New York, for instance, who said he's treated 350 patients with it, and he's 350 for 350. That's a good sign. Why isn't this being cheered and rejoiced? Why are people trashing the president, governors stopping it from being dispensed? What is behind this, sir?
Well, so some of this is politics. I mean, there was an Ohio legislator who wants to refer the president to The Hague for recommending something that a lot of people in the world are using. I mean, I try to take the same approach to this drug that I take to looking to the totality of the situation, which is to look at what's happening on the ground and look at the evidence. And so I think we know a lot about the drug safety profile. We know less about its effectiveness in this area. And so what you're really looking at is a situation where the medicine, it might work, and there's a plausible or theoretical reason for it to work. You're hearing reports of potentially positive impact. You really don't know for sure until you do a study, a comparative study, because you can have biases in those data and those reports. So that's what's needed to say whether or not it really works. And the president hasn't said it works. He said it might work, and he's optimistic. Well, that's great. I think that I agree with you. I mean, I think, look, if you don't have options and you're sick, this is a decision to be made between a patient and a physician, knowing that the risks to taking the drug are small for most people, and the benefits could be substantial. Again, I'm not going to say it works. I don't know whether it works or it doesn't work, but I also don't think it's likely to do harm for most people. Now, some of the governors may be well-intentioned in the sense that this medication is used to treat autoimmune conditions. And so if there are true shortages and they're concerned that people who are taking it for a bona fide for reason that for which it's been prescribed because we know it works, in those types of situations where there's a shortage, I could understand certain restrictions or limitations temporarily. So if that were the basis for it, that's a difficult decision that needs to be thought out. But as it turns out, that immunologic mechanism is potentially the reason it would work in this disease. It works for autoimmune. It's suppressing the immune system. So it works for autoimmune diseases. And the question is part of what's going on with coronavirus infections and what they call a cytokine storm, an excess immune reaction in the lungs. And the answer is yes for people who are seriously ill and die from it. And that mechanism could work and be potentially effective to treat these folks as well. So as long as the drug's available, I don't have a problem. I agree with you completely. I think it's a decision between a doctor and a patient, but I can understand if there are true shortages, if that's the motivation for restricting supply. That's a value judgment that needs to be discussed and debated.
You're on the John Fredericks Radio Network, Trucking the Truth Across America. We're with Dr. Roger D. Klein. Dr. Klein, you put a statement out the other day saying you believe the United States should begin preparing to reopen segments of the economy on a targeted basis, transitioning away from extreme social distancing measures that you said have limited empirical support of effectiveness. And obviously, again, the other side of the model is the economic and other social calamity that this is causing Americans. Can you elaborate on that, sir, in the time that we have?
Well, we don't have real data that suggests that this works, and we don't. What's social distancing? It could mean all sorts of things, but so we actually don't have real studies of the sort that you would seem to be demanding for hydroxychloroquine. That we don't have those kind of studies for social distancing, and you have economic consequences again. Are very severe if most people don't have a lot of savings. They can't go on for a long time like this, and they can't lose their jobs permanently. You can't have somebody's lifetime of work destroyed based on a theory. So I think we need to try to be balanced considerations. I wish we would be doing more serology, targeting our responses, protecting those who are most in danger, understanding that some people have really bad reactions to this who won't fall into that category, and be very sensible, common sense. You can stay home, but you don't have to close everything. We can, again, as the congressman said, we can change our lifestyles, but we don't have to abandon them. And I think having a more moderate approach and a targeted approach, a more dispassionate approach, will be, over the long run, more helpful.
Yeah, wash your hands, don't touch your face. I mean, it's pretty simple. I've only got 2 minutes, but I have to get into one other thing, and that is President Bolsonaro in Brazil, many people call him Trump of the tropics, took the exact opposite approach of every country. He's done nothing. And he has gone with what he calls herd mentality, that, okay, people will get sick and people will die, but we're going to get past it. We're not going to close the economy. They've done, other than the basic things, moderate social distancing, wash your hands, don't touch your face, don't put yourself at needless risk. They haven't done anything, Brazil, and they've had 2 deaths per million people, which is on the same par with Australia. And they haven't done anything, and they're in better shape than we are. Why?
Well, I don't know if we know for sure, and it's hard to compare it's hard to compare the United States to any other country. I cringe every time they compare us to Italy and Spain, but I think that part of it could be with the hemisphere. So some of it may be that these things aren't as important as we think they are. But if you look in the southern hemisphere where they're in summer right now, countries like Australia, New Zealand, South Africa, I look to Australia and New Zealand because they have modern systems, although they're still islands. But you're not seeing what we're seeing here, and I think I'm hopeful that this reflects the seasonality, and that as here the spread of this will abate, at least somewhat. I'm not saying it's going to go away, but I think we can be optimistic in when we look at the southern hemisphere that perhaps it will have a seasonal component to it.
Your best guess, when do we get back to work?
Oh God, I don't. Date is. I think we need to start moving back quickly. I mean, if these 2 weeks don't, if these 2 weeks don't turn out, this week was supposed to be the worst week of Americans' lives. I mean, if they don't turn out to be the horror show, look, every death is horrible, so I don't want to sound callous.
Right, Doctor.
But if we don't see this explosion over the next couple of weeks, and we still see a linear rise, and we're looking at death numbers that are in the flu, continue to be in the low flu range, which is where we are now, I think, or at least for estimates, I think we need to start moving forward. But the president's extended it through the month. Let's see how these couple weeks go, and if we're not seeing the explosion, I think we need to start taking a more targeted approach to the restrictions on which people are placed.
Dr. Klein, spot on. I learned 2 things today. Number one, we can change our lifestyle without abandoning, which is what the congressman said from Texas. The other thing it taught me is that this right now is linear, not exponential. And remember, everybody said this is exponential. Right now, it's linear. Now, those in favor of shutting the economy down and destroying the economy so they can rebuild America in some kind of a socialist state, they're going to say, well, it's only linear because we shut everything down. That's going to be the other side of the argument. Dr. Klein, thank you for being with us today.